Good afternoon. Today we'll be sharing an update on the work of the Reopening Advisory Board and specifically outlining the phases Massachusetts will follow as we move forward in reopening our economy. First, I'd like to share a quick update on testing and hospitalization. Yesterday, we processed almost 12,000 tests. That brings the total number of tests processed in the Commonwealth to 388,389. That continues to make us a national leader. And if we were a country, we'd actually be a global leader on a per capita basis. There were 1,050 new cases of COVID positive tests. That represents 9% of total tests conducted coming back positive for the virus. That's obviously a pretty big drop from where we were a month ago. We continue to have daily conversations with our partners in the healthcare community to monitor hospitalization rates and capacity. The number of cases currently hospitalized is down to 4%. The weekend's data represents downward trends across many of our key metrics, which is encouraging. But the one thing I would say is sometimes the weekends are a little misleading. We would probably need to see what happens today and tomorrow just to be sure that everything that was supposed to come through on the weekend did. Massachusetts remains, I think as everybody knows, one of the hardest hit states by the COVID-19 pandemic in the country. We still have work to do to contain the infection rate, reduce the number of people who need serious hospital care, and make sure that our healthcare system is prepared to operate in a COVID world and do all the other things that it does on behalf of the people of Massachusetts. We're obviously continuing to monitor the daily informations and trends over time to help us focus on next steps. The process is complicated, it's gradual, and it requires an incredible amount of patience from pretty much everybody, including me, but we believe we are trending in the right direction. As of yesterday, having never distributed a single piece of PPE ever during our first 5 years in its administration, we distributed our 10 millionth piece of PPE to hospitals, nursing homes, community health centers, cities and towns, and first responders across the Commonwealth. That includes, I think as everybody knows, gowns, gloves, masks, ventilators, and other gear and supplies. Since we launched the Reopening Advisory Board on April 28th, the board's now met with stakeholders from 44 different industry associations and community coalitions, representing more than 110,000 businesses and more than 2 million workers across Massachusetts. In the past week, they met with regional chambers of commerce, labor representatives, and industry associations and consortiums representing construction, hospitals, dentistry, museums and cultural institutions, sports, arts and entertainment, cafeterias, casinos and gambling, cannabis, fitness, hair salons and personal care, and manufacturing, to name a few. Yikes. These presentations have built upon the discussions the board's been having with representatives from retail, high-tech, life sciences, restaurants, travel and tourism and lodging, banking, construction and recreation, as well as the Black Economic Council, the Latino Chamber of Commerce, and the NAACP. Additionally, the Reopening Advisory Board has received written comments from more than 2,200 employers and organizations. And we are obviously extremely grateful to the many participants that have taken the time to engage in these discussions and share their ideas with the Commission, the Board. Across our secretariats, working groups within the administration are also planning for next steps on testing and tracing, outdoor recreation, higher education, transportation, and childcare. Those conversations are crucial to the decision-making process and take into account the input and perspective of many of our local officials and other stakeholders across Massachusetts. The goal is to come up with plans to ensure that we reopen as safely as possible across the many different industries that make up the Massachusetts economy. The board's in the process of developing a full report that will be available on May 18th that will outline those plans, including the activities and industries that are safe to resume by phase, mandatory workplace safety standards about distancing, personal protection, and cleaning protocols that all workplaces will need to follow upon reopening, and sector-specific protocols for how different industries should operate when they reopen. Considering the highly contagious nature of COVID-19, our decisions and timing is influenced by the public health data that informs us with respect to spread of COVID-19 in our communities and across Massachusetts. Monitoring that public health data has been a key part of our reopening process and will help us determine what is the safest way to get our economy up and going again. We're all focused on getting to that place, but we have to ensure that when we take one step forward, we do not end up taking 2 steps back. To help businesses start to prepare for reopening, today we're announcing a 4-phased approach that Massachusetts will use to reopen. We're also announcing the mandatory workplace safety standards that all employers across all industries will need to adopt and adhere to. The Lieutenant Governor will provide more detail on this shortly. In the coming days, we'll also be releasing industry-specific guidance. This guidance will ensure that each industry has the information they need to operate safely once they are phased into the reopening plan, and that information will be critical to their ability to communicate effectively with their employees and their customers about how they plan to operate in a COVID-19 world. Back to the details with respect to the 4-phased approach. On March 23rd, all non-essential businesses across the state were forced to close to prevent the transmission of COVID-19. We know this hasn't been easy, and that many businesses, large and small, across our communities have suffered as a result. And we're anxious to try to get everybody back up and going as soon as it makes sense. The goal of the reopening plan is to methodically allow certain businesses, services, and activities to resume while protecting public health and limiting a possible resurgence of new COVID-19 cases. To that end, Massachusetts will follow what we're calling a 4-phased approach. Phase 1 is what we're calling START. Here we're looking at industries that are more naturally set up to have little face-to-face interactions and workplaces that are better able to manage face-to-face customer interactions with certain conditions. Phase 2 is called Cautious. We plan to have more industries with more face-to-face interactions resume operations, again with conditions. Phase 3 is going to be called Vigilant, where we can allow for loosening of some of the restrictions from some of the earlier phases if, in fact, the public health data continues to conform to the terms that we're all pursuing as we look at that going forward. And all 3 phases will depend, as I said, on the prevalence of the virus and especially on the conditions in our hospitals. And phase 4 would be what we would just call the new normal. We all know life will be different, but as the medical and life science communities make progress in developing treatments or vaccines, we can really begin to put this virus into the rearview mirror. But none of that is going to happen overnight. We'll continue to follow the data and the public health metrics to determine when phase 1 start of reopening begins, and then when it's safe to move on to current phases after that. The goal is to begin this process around May 18th, but it will be gradual, and the facts on the ground will obviously determine whether we actually hit that goal. But keep in mind, this is a disease we're still learning about across the globe. We've been one of the hardest hit states with almost 5,000 deaths and nearly 78,000 confirmed cases. That means we have to be flexible and honest about the fact that the timing and the details of these phases could change depending upon the track the virus takes as we go forward. If public health metrics indicate that a particular sector or industry is unexpectedly susceptible to spread, then that specific industry's reopening may be delayed to a later date. We'll also have to revisit our reopening approach if at any given time there's evidence of widespread community transmission or an unexpected new spike in cases, because we will not only continue to test, but significantly enhance our testing capability as we go forward. Obviously, we hope that none of these setbacks occur. But as we've seen around the globe, there are no guarantees when it comes to dealing with COVID. And our ability to move forward through these phases depends almost entirely on everybody playing their roles. Face covering, staying at home when you feel sick, washing your hands, using hand sanitizer, staying 6 feet away from others whenever possible, and how well everybody else does these things and others will determine how we move forward and how successful we are. People here have done a tremendous job under some very difficult decisions and circumstances, and we have, in fact, flattened the curve. But to keep moving forward, everybody must continue to keep it up. We'll have additional information in the coming days about which industries and activities will open in each phase based on the trajectory of the public health data. It's incredibly difficult to plan for a future while we don't really have real certainties about how this particular virus moves and relates and acts across time. We'll also continue to work with our neighboring states to collaborate on the reopening strategy. As a small New England state, it's important to remember that we exchange information and ideas with other eastern states to be consistent and unified wherever it makes sense. Members of the Governor's Office and our Cabinet continue to work with the Eastern State Coalition, and much of their input is woven into our reopening strategies and plans as well. These last couple of months have obviously been painful and difficult and frustrating for us all. But as I said, we are seeing positive signs that the work everybody has done has been paying off, and that makes it possible for us to be serious about a phased reopening. We'll continue to bring you updates and provide as much guidance as we possibly can as we move forward. But to even get to this point, to where we can have a framework and a strategy that's focused on reopening, we need to appreciate how much hard work people did to get us here and why this notable milestone has been made possible by everyone here in the Commonwealth. People have done terrific work, followed up on countless requests to only go out if they needed to stay home whenever they could, and to recognize and understand the closing up businesses and going for many weeks at a time outside their normal activities was a big part of how we got back to something like a normal life. And we've all foregone and postponed critically important life events like weddings and funerals and graduations to be safer in the wake of the virus. Our hospitals, our healthcare workers, our transportation workers, our grocery workers, our first responders, our emergency management personnel, our DCF social workers, so many people have built an army of frontline workers who are out there doing work every single day to protect us, to support us, and to serve us, and in many cases, doing so recognizing and understanding that they were in fact on the front line. Our National Guard has stepped up to support our most vulnerable residents in a really big way, and so many of our people have stood up to every single challenge they've faced over the course of the past several months. The key roles that everybody's played have made an enormous difference in getting us to this particular point in time. And I know you've heard me say this before, but this is no time to quit. We have to keep driving. We have to keep following the data. We have to understand and respect the virus. And if we do those things, we will get there, and we'll get there as safely as we possibly can. I'd now like to welcome the Lieutenant Governor to talk a little bit more about the mandatory workplace safety standards. Thank you.
Thank you, Governor, and good afternoon. Over the past several days, with Co-Chair Secretary Keneally and Commissioner Monica Burrell, we've covered a lot of ground and been supported by dozens and dozens of individuals and businesses to help us think about our future. The Advisory Board has spent hours talking to people across different sectors and industries, as you've heard the Governor list, about their ideas and strategies as we progress toward the new normal. We still have a lot of work ahead, but I am heartened by the creativity and the grit of our residents who are contributing to this next chapter. COVID-19 has placed an incredible burden on our economy, created uncertainty and losses for every region of our Commonwealth. But together, we are developing the framework and phases that the Governor described to put us back on track as quickly and as safely as possible. This is a true team effort, and I'm proud of the body of work we, along with the incredible members of our advisory board, have put together and have started to put together. I'd like to get into more detail on the mandatory workplace safety standards that the Governor mentioned. Part of moving forward and making workplaces safer will include 3 levels of guidance for every sector, every industry, and every business. The first is overall social guidance about how people should conduct themselves that are already in place. This includes policies we have already implemented, such as limiting the size of social gatherings, requiring individuals to wear face coverings in public, and instructing those entering the state to quarantine for 14 days. The second includes these mandatory workplace safety standards that all businesses must adopt upon reopening. The third will be industry-specific protocols that we will release and have more details on in the coming days. In phase one of our reopening, all workplaces in the Commonwealth that are allowed to operate will be required to implement these mandatory workplace safety standards. The standards were developed by the Reopening Advisory Board, working together with the Department of Public Health and the COVID Command Center. They are designed to be straightforward and to reduce the risk of COVID-19 transmission as employees and customers begin to return to workplaces. These are the basics that every industry can plan for regarding social distancing, hygiene, staffing and operations, and cleaning and disinfecting. For social distancing, all persons, including employees, customers, and vendors, should remain at least 6 feet apart to the greatest extent possible, both inside and outside workplaces. Establish protocols to ensure that employees can practice adequate social distancing. Provide signage for social distancing. And require face coverings or masks for all employees. For hygiene, provide hand washing capabilities throughout the workplace. Ensure frequent hand washing by employees and adequate supplies to do so. Provide regular sanitization of high-touch areas such as workstations, equipment, screens, doorknobs, restrooms throughout the worksite. For staffing and operations, provide training for employees regarding the social distancing and hygiene protocols. Employees who are displaying COVID-19-like symptoms do not report to work. And establish a plan for employees getting ill from COVID-19 at work and a return to work plan. For cleaning and disinfecting, establish and maintain cleaning protocols specific to the business. When an active employee is diagnosed with COVID-19, cleaning and disinfecting must be performed, and disinfection of all common surfaces must take place at intervals appropriate to the workplace. As we move towards a new normal, we all have a lot of work to do, and we are thankful to everyone that has done their part and has played a role in this fight against COVID-19. And I am confident that when we reopen, we will do so in a safe manner for all the people of this Commonwealth. Thank you.
Questions?
When are we going to know who is in what phase? How much of a heads up are you going to give businesses?
Well, I think it's expected that the report itself will lay out, as the Lieutenant Governor and I both said, 4 phases, and people will need to be able to speak to their ability to deliver on these general criteria, which are being released today. But there will be industry-specific criteria that will also be released in industries where we believe we need specific criteria, and that criteria people will have to be able to attest to before they can open.
But are we going to see, and you can speak into the mic, sorry, but are we going to see it like other states have said, okay, this phase is restaurants, this phase is hair salons,
Yeah.
etc.?
Yeah.
Well, how concerned are you moving into this next phase? It's a little nerve-wracking because we've been cloistered at home, this is closed, and we're not quite the new normal, and yet this is a big change for Massachusetts.
Well, the first thing I'd say is that there are a variety of employers who've been operating under the essential criteria during the course of this pandemic. They're now going to need to comply with the universal guidance when it gets issued on May 18th, the same way everybody else will need to comply. And for some of them, there will be industry-specific guidance that they'll need to act on as well. I mean, one of the big things to realize as we head into this next phase is there's no longer going to be what we've thought of all along for the past few months as essential and non-essential. There are going to be businesses that are able to operate based on their ability to abide by the global standards as well as by industry-specific standards for their operations. and then a phased roll-in based on, as I said in my remarks and the Lieutenant Governor said in hers, based on our belief about those particular industry categories' ability to abide by and deliver on those guidelines, which means starting with some of the businesses that have the least face-to-face interaction or the closest contact with customers as we traditionally think about it. But I think part of the reason to have all these conversations that the Lieutenant Governor and her team, and Commissioner Burrell also serves on that team, and Secretary Keneally co-chairs it. Part of the reason to have all those conversations is to get employers into the dialogue and into the discussion about what an operating model in a world where you're trying to prevent the spread of a hugely contagious virus looks like. And I think that's just as true for them as it is for all the rest of us. And that certainly comes with a certain set of new skills and appreciations and understandings that people are going to have to develop and work with. But I think it's also understood that a huge part of what we've been doing for the past few months has been to protect our hospital and our healthcare system, to make sure that it could treat everybody that needed to get treated who was sick with COVID, and at the same time continue to be able to serve people who had other conditions. For the most part, that's been successful. Now the goal, since we've started to see downward trends on the key measures that we've talked about around testing and ICU use and hospitalizations and all the rest, is to start to get the regulators, which would be the Commonwealth and the cities and towns, and the employer community, comfortable with how a phased reopening might go, who would be involved in the earlier phases, what would be expected of them, and how that might roll out. And again, those conversations that have gone on in the reopening advisory board with employers, and the conversations that have gone on with governors and with secretaries and others about how people across the Northeast are thinking about this have been incredibly helpful. But I think we all get the fact that, there's been nothing comfortable about this starting in the middle of March, and I would expect that the reopening is probably going to be somewhat uncomfortable too, for the same reason, because it's all different.
Governor, an ice cream stand out on the Cape tried to open up over this weekend. It turned out to be pandemonium down there. Are you concerned that as these are phased in, that's going to be commonplace?
I've actually been to that ice cream place. I think you've been there too. I think anybody who's ever been to the Cape has been there. It's an enormously popular place. I feel terrible for the owner, who everybody I know says is one of the most decent people you'd ever want to meet. I feel awful for the young kids who were just trying to serve a product that people really wanted, which is kind of a rite of the arrival of warm weather and summer and all the rest. And I guess what I would say is that as much as we all might not like some of these changes in the way things work, and I'd certainly put myself on that list. I'm a basketball player. I always was. I have a hard time understanding when we're going to be able to play basketball again, because it's a very physical sport with a lot of close contact between and among the participants. But I think we have all got to stand up and recognize that this is going to put almost everybody in a somewhat different position than they've ever been in before. And day in and day out, I believe the vast majority of the people in Massachusetts will stand up and accept their responsibility. And remember, one of the biggest responsibilities here around face coverings and many of these other issues is to make sure you don't give this thing to somebody else, because there's such a high penetration of asymptomatic cases, and that we have to hope and understand that that is the overwhelming response that people take to this. So far it has been, but I feel terrible for what happened to those folks.
How do you deal with people who aren't going to play by the rules? Customers, folks on the street?
Yeah, I mean, one of the things we did with our, I think signage is a big part of it. I think awareness is a big part of it. And I think there is a certain amount of socialization that comes with this as well. And that's part of the reason for I keep pointing up there, it's not there anymore. This is part of the reason why the Reopening Advisory Board felt it was important to establish not just industry-specific guidance, but a set of criteria that we're going to apply to all employers, so that it becomes, for all intents and purposes, something people think of as sort of standard operating procedure. When you get talking to the colleges and universities about how their world is going to look in the fall, they aren't talking about this on an individualized basis with us. I mean, they're talking about it as a group and saying, you know, what is it that we as a group need to be thinking about? They've been spending a lot of time with the folks at Public Health and others, and they obviously have lots of people on their own campuses who have opinions about this. But they're trying to figure out what, you know, their socially acceptable, responsible way of operating is going to look. And I think, and I do believe most people will get there. I do, because they did in an incredibly short period of time under, you know, incredibly difficult circumstances from the time this all started in March. But again, this is part of the reason why we're doing this on a phased basis. It makes it possible for us to track what's going on the ground. It makes it possible for us to learn from the early movement that takes place here. And I honestly hope that for the most part, people do what I would describe as the right thing for their neighbor, for their friend, for their colleague. And I think they will. And I hope that the socialization of that ultimately becomes sort of an important enforcement mechanism in this.
If I could follow up on that and broaden it out a little bit. In some of our neighboring states, in more advanced states of reopening, there are reports of a lot of Massachusetts license plates in New Hampshire, in Rhode Island. Is that a concern for you? And do you feel that that could have any kind of adverse impact on reopening? Thank you.
Yeah. The thing I come back to on the states around us is different states got hit differently by COVID-19. And I mean, Massachusetts took a much bigger blow than any of the states around us until you get down to New York and New Jersey, which were obviously incredibly significant hits as well. And I've had conversations with Governors Raimondo, Scott, and Sununu, and Lamont, and Mills about their plans with respect to how they're thinking about reopening. And in many cases, just the facts on the ground for them are really different than the facts on the ground for us. We all recognize and understand that. And as a result, people are going to end up playing this a little differently. But I don't think it makes sense for us with a different set of facts on the ground to make a decision to do something that's being done somewhere else just because they're doing it. I do want to know, and one of the reasons why those conversations between and among the governors and the cabinet secretaries and others are so important is A, we learn something from how others are thinking about it, but B, we also make sure we know what's coming. I knew what was coming in New Hampshire and Vermont and Rhode Island because we had been talking to the leadership there. But I don't think, the way I described this last week was I said, I think in the end, most of us, you get out a couple of months from now, I think most of us will adopt practices and procedures that are going to be relatively consistent. They won't all be exactly the same because our economies are different and all the rest. But I do think they will in many cases be fairly similar. What I don't think is going to happen is that they're going to land at the same time because the states are just in different places and we're hit differently by this virus to begin with.
Governor, how do you see in your reopening, like, do you envision a certain amount of time for each phase at this point, and then how long before together do you envision this sort of moving through?
So that's a really good question, and if you look at the way other states have teed this up, people have bought themselves a lot of latitude, and I think this is appropriate, between phases. People have basically said, people have said things like, it's going to be 4 weeks between phases unless the data tells us something else. It's going to be 3 weeks between phases unless the data tells us something else. It's going to be this amount of time unless the data tells us something else, which is, I think, the way states are trying to balance the idea of giving people some ability to plan, but at the same time recognizing that if there's some huge spike in what happens, between the opening of, phase 2 and phase 3 or phase 1 and phase 2 that requires them to change course, that they need to have the latitude and the ability to do that. But that's generally been the way other states have done it, and I think in the end we'll probably work off a similar model, which will provide people with a little bit of guidance. But in the end, if the data looks really good, that's great. You go ahead and you go to the next phase. If the data looks really bad, then you got to reconsider what you've done and figure out how to solve for the whatever the particular issue is.
So it's fair to say that you guys are looking at about a month for each phase?
Say what?
It's fair to say you guys are looking at about a month for each phase?
I said that other states have put that out there as a marker, but they have all said unless we think it needs to go longer. So you got to be careful about, there isn't going to be a hard and fast on a lot of this. People are going to want to see what happens because for everybody, this is a new experience. It's unprecedented. It's the first time anybody's had to do this. And all you really have to rely on is sort of the 30 or 60 days ahead of you that comes from either what's happening in Europe or in Asia or the 2 or 3 weeks with respect to what's happening in the U.S.
Governor, some hospitals say they're set to resume certain elective surgeries today. I was wondering as a whole where elective surgeries stand at this point of the reopening plan.
We're talking to the hospital community about how to think about living in a post-surge world. But there are a lot of important elements to that have to get ironed out. I mean, if you think about it, one simple way I can express this is we put a lot of emergency orders in place, working with the healthcare community to make it possible for them to deal with the surge. To go back to kind of normal, we need to have a conversation about what happens with all those emergency orders, which have a lot to do with staffing, operation, organization, structure, and all the rest. And I really want to make sure we process those properly.
But they are allowed to resume some now, right? They made the announcements today saying in some cases effective immediately for certain procedures. They're not violating, there's going to be additional guidance on that at this point, correct?
I'm not familiar with what you might be speaking to. I do know we've tried to make pretty clear to the public here in Massachusetts that while our healthcare committee and our community has been incredibly focused on COVID, that if people have other medical conditions that they're concerned about, they need to call their clinician, they need to go to and if they're really worried, they need to go to the hospital. We've been saying that for months. And there's no question that in some of this is a tough call, which is when does an elective become something that really needs to happen? When does do you think about preventive procedures in some respects as being electives? I mean, our view is some of that's a decision that has to be made between a clinician and a patient. But our big message has been, we did a lot of work here in Massachusetts to make it possible for our healthcare system to treat people who are dealing with COVID and still be able to treat people who are dealing with other stuff, and that's the way we've been all along. But for us to get to what I would call the next phase with the healthcare community, I'm looking at the commissioner here, I think there's a whole bunch of conversations that we need to have around how do we go back to a lot of the rules and the standards and the protocols and the policies that we either rewrote or changed in a pretty big way to make sure that we could deal with COVID, because that's got to be part of where we go.
What's the phased approach for daycare reopenings as the rest of the week?
That child care, we had a long conversation about that this morning. That's going to end up being part of the conversation as well, and that one will absolutely be phased because there are a lot of issues there that have to get worked through.
Where is testing going to factor in? How is testing going to factor in from going from phase to phase? Is that one of the metrics? Do you see a further expansion of testing? Are we doing multiple thousands a day?
I do think you'll see a significant expansion of testing, yes. And it will be in the report. But basically, we anticipate a pretty significant growth in testing all the way through the fall.
On asymptomatic folks as well, or antibody testing, or can you elaborate on what?
I'd rather talk about testing when the package is a little more fully developed, but I certainly think antibody testing has a role to play. But I've stood in front of this crew before and said that antibody testing has a role to play but I've also said I do not believe it has gotten to the point where it has the ability to play the role that everybody would like to see it play tomorrow. And we were just talking about this upstairs. There's a lot going on there, and it will have a role to play, more as a surveillance mechanism than anything else. And people literally want to go from here to here on what antibody testing means. There's a ton of uncertainty between where antibody testing is today and where people want it to be. And do we think it can probably get there? Yes. Do we think it's going to be there by the 18th of May? Yeah, right. No. So I think we'll be talking about testing as part of this whole initiative, and we certainly expect that that testing has a major role to play in what happens going forward. But the antibody piece has a role to play too. But I think we would say, for what people are saying it can do and how it can fit in, it has work to do.
Last question.
Highlights what key industries you might see as part of that first phase when you consider this business.
I think all I would say is that the conversation that's gone on at the Reopening Advisory Board has been that, in first phase, you should probably start with the things that don't have a lot of direct contact with customers, or are things where if there is direct contact with customers, it's the kind of direct contact you believe you could really carefully manage and write guidance for that would be relatively uncomplicated for people to comply with and relatively easy for local communities if they needed to monitor.
Governor, we've seen some good progress in Western Mass.
I can't hear you.
We've seen some good progress in Western Mass. Have you thought about opening businesses there maybe a little bit sooner than you had thought initially?
Well, the 18th is now a week from now, and the one thing about this virus that we all need to be careful about is its unpredictability, and that's one of the reasons why so many of the people who've talked about this have said you need to see a sustained trend. They don't say you need to see a trend for a few days, you need to see a sustained trend. And while I think all of us have been incredibly heartened by what we've seen out of Western Mass, because Western Mass was one of the places that got hit incredibly hard right out of the gate, I think we'd like to see a few more days of the kind of positive trend we've seen not just in Western Mass, but in a bunch of other places. And then we'll make the call.
Thank
Thanks.
you.